Welcome to the Transforming Trauma podcast. Transforming Trauma is presented by the NARM Training Institute. The Institute offers NARM practitioner trainings for mental health professionals who are looking for advanced training in complex post-traumatic stress disorder. The NeuroAffective Relational Model is a cutting-edge, innovative approach for resolving CPTSD, addressing attachment, developmental, relational, and intergenerational trauma. I'm your host, Sarah Buino, and I'm delighted to have you join us today. Our guest for today's episode is Mark Olson. Mark Olson, Ph.D., LMT, has an MA in Education and a Ph.D. in Neuroscience from the University of Illinois. He holds a specialty in cognitive and behavioral neuropsychology and neuroanatomy, which focuses on memory, attention, and eye movements. He's the owner and director of the Pacific Center for Awareness and Bodywork, which integrates bodywork with somatic psychology, contemplative practice, and affective neuroscience with a trauma-informed framework. Recently, he's been published writing on the subjects of pain and trauma-informed bodywork. So please enjoy my conversation with Mark Olson. Hello, Mark. Welcome to Transforming Trauma.
Hi, Sarah. Thanks for having me.
Yeah, we're so glad that you're joining us. And we always like to start the episodes by asking the question that we ask in every NARM session, essentially is what you want to get out of it today. What do you want listeners to get out of this episode?
I would love listeners to get out of this episode a different way of seeing massage. That's where I'm at. That's the field I'm coming from. And to maybe consider that a lot of the things that make a psychotherapy session work are the same things that make a massage session work. It's completely different than what I think a lot of people normally think of as what makes a massage session work. But it's not really any of those fancy techniques with fancy names. It has a lot more to do with the same kind of relational attributes that make a psychotherapy session effective.
Well, now I'm even more excited to have this conversation. So let's fill listeners in on more about who you are. Obviously, you're a massage therapist, but tell us, who is Mark?
Yeah. So my background is in neuroscience. I got my PhD in neuroscience from the University of Illinois. I studied the psychological end of neuroscience. You know, some people study molecules and cells, but I studied brains and how we think and remember and how we pay attention and that kind of thing. So I was never thinking about massage at all when I was in graduate school, and except for that it was a nice thing to do during study sessions. I studied neuroscience because I was really interested in what makes us human. You know, why do we behave the way we do? Why do we think the way we do? Why do we feel the way we do? And when massage kind of came along, you know, I thought massage would be something that would be fun to do, just as a side thing, you know, kind of like learning any other little skill on the side. But little did I know that actually there's so much more to it than, you know, making a knee feel better, making a shoulder feel better. I realized over a number of experiences that there's so much more depth to it. Neuroscience is the perfect tool for looking at massage. It's not about muscles and fascia and tendons like most people think it is. It's completely about the nervous system. So at first, you know, I thought of massage and neuroscience as being worlds apart, but now I realize that it's really the best lens to look at bodywork is through a neuroscientific lens.
Well, let's dig into that. Say more. I mean, I get it superficially, but I really want to understand this better.
Mm-hmm. Well, I mean, there's this idea in the world which has some merit that bodywork is about bodies and psychotherapy is about minds. But I think most of us, especially those of us listening to this podcast, probably recognize that can't really make very clear distinctions. Neuroscience blends those two very well, the body and mind world, and kind of talks about both of them simultaneously without making that distinction. But of course, we have to make the distinctions just to talk. But people come in for body work because either they have anxiety or because they have pain. And so right away, we're already in this mind world. Anxiety, obviously, is very mind-based, and pain is a very complex topic that has numerous, you could just say, mind elements to it. And that's a huge topic that we can get into if you want. Pain and anxiety are already in a mental space. So if we realize that that's what's happening in a bodywork session, then we might as well truly understand what's going on when we touch bodies. What does touch do? How does it do what it does? What does that relationship with the therapist do with the nervous system? How does that change? Why does it feel so good? How does that work? Some of these questions seem really simple on the surface, but if you start really diving into them, they become a very deep rabbit hole.
Yeah. I'm thinking, no, those are not simple at all, but they're questions that don't get asked very often, which I think also parallels some of the questions that we ask in NARM,
Mm-hmm.
because a lot of times in psychotherapy, we're trained to interpret and assume, essentially. And NARM is like, no, we don't do that. We actually ask for clarification for those things. So it's an interesting connection there.
Yeah, absolutely. I think in bodywork, there's a tendency to feel like one has the solution, like that something is broken in the
Hmm.
client and that you have to fix it. There's a lot of talk about this muscle is too short or that fascia is too long. People talk like that as if it's just truth, but it actually isn't. None of those things are true. It's just an old idea that keeps being perpetuated. And it's actually really harmful because it sets up this dynamic of the client feeling that they're broken and the therapist thinking that they're the ones to fix it. When that doesn't work in psychotherapy and it doesn't work in massage either.
Right. Well, and that kind of like leans us toward talking about trauma. But let's talk first about how you discovered NARM and how you discovered NARM. I'll ask one question at a time today.
Sounds good.
Yeah.
Maybe I'll answer it one question at a time too.
All right.
So, well, I was very fortunate. When I run the Bodywork School here in Hawaii, and like I said before, that I was becoming curious about the relationships between neuroscience and massage. And I worked at a lot of different schools, and the one that I'm now the director of and the owner of, I came across and realized that things were being integrated with psychology here in a way that was unique. And I had the fortune to meet the owner, the founder of this school. And soon after he died, I wanted to find other people who could come in and teach some of this material as well. And so I was very fortunate to have met Brad Kammer, who, of course, teaches our NARM classes. And he was teaching for the same person I was teaching for in California.
Hmm.
And so I was just really lucky that I met Brad and I had Brad teach in my program. At that point, it was really an intellectual interest. It was about providing content to the course. I didn't really know about NARM per se. I just wanted information about psychology and trauma to be offered. But very soon I realized that the kinds of things that he was an expert in, the NARM material, had profound implications for what we
Hmm.
teach and how we teach it and how we run a school. And I just dove right in.
That's really incredible. I'm so curious to find out how you integrate NARM with massage. Like, tell us what a massage looks like when somebody comes in to see you.
Mm-hmm. I guess one of the first important things to be clear about what that doesn't look like.
Yeah.
It's not about psychotherapy being mixed with
Hmm.
body work. So some people think that would be the case, but that's just not what we're doing. But nevertheless, if you're applying those NARM principles to every interaction you have, regardless of what the setting is, you're going to have a better interaction. That client's boundaries are going to feel more held. Their subjectivity is going to be honored more. They're going to feel more safe, their sense of implicit safety. And if those things happen, then a lot of other things can possibly happen. Because if we really think about why are those muscles doing what they're doing it for various reasons that the nervous system is dictating. And some of those are spinal in nature, some of those are brain-based in nature. So if the brain is telling the muscles to do what they're doing, and we think that we could change that just by pushing on them, that's a mistake. If there's a relational component, like the way this person's nervous system has organized over time, and we meet that organization with maybe a different pattern. So clients, when they're in a massage setting, they're in maybe the most vulnerable setting that they ever are. It's arguable that more vulnerable than in a psychotherapy setting because they're often not clothed and
They're naked.
they're naked, they're going to be touched. So that brings up a lot for people. Whether we feel like we're dealing in psychotherapeutic concepts or not, we are bringing up psychological
Hmm.
content.
Right.
And so at the very least, we need to be able to work with that, not work with it in the psychotherapy setting, but be with it, be okay with it, accept it, not have some kind of response to it like, oh my gosh, what's wrong with you? Or be afraid of it or try to suppress it or ignore it, or just be okay with it. And I think a lot of people have never experienced that. So if they have a therapist that is okay and they can really feel that, that has a potential to create some profound changes, if nothing else, in the way they're holding their muscles. I mean, we don't really care about the muscles unless the client cares about the muscles. I think, this is one of the differences is if you think that massage is about muscles, a therapy session with NARM as its basis isn't about muscles. It's about meeting the client where they're at, establishing the goals, what they're wanting. So if I see you and I can feel that your muscles are tight in some spot, tense in one spot, or I see that something is not symmetrical, I really don't care unless you care. And then we can explore that together. So it's very NARMing in that way, setting up a goal.
Yeah. Very consensual.
Mm-hmm. And being curious. Curiosity is running the program. So if I have some idea about what's wrong with you, that's maybe a beginning place to explore curiosity with, but I'm not going to impose an agenda about what you need. And that may seem all very obvious, but in the world of bodywork, that's actually not the norm.
Yeah. I'm really thinking about going back to what you said about how vulnerable it is for people to be in that scenario and how trauma can come up. And it was just making me think, I totally forgot about this, but it wasn't even a massage setting, but I was getting my hair done. This is obviously before COVID times. And I was getting my scalp massaged as they do when they do your hair. And I had been working through some sexual trauma and I started bawling. And lucky enough, I know the stylist well enough, and she was just so kind. And I was like, yeah, this is just some trauma coming up. And she was so sweet. And she was like, do you want me to stop this? What would you like? And it was just so beautiful. And it wasn't even something I was thinking about. So it just reminded me so much of the power of touch and how that activates the trauma. And I'm curious, in your work with clients, have you seen things like that come up? And how do you use NARM to really support people through those moments?
Sure. Well, there's sort of two levels, the way I think of it. If someone's having what I would call a shock trauma response, that would be...
Do you want to define that for listeners, just so they know?
Sure. So, I think most people, when they think of trauma, they tend to think more in terms of shock trauma. I want to say events, but I don't want to define trauma on basis of events. But anyway, things like, car accidents and violent episodes, that one-time events often. So, for instance, a person coming back from war, they're on your table and then there's a loud sound outside the room and they think that they're back in Vietnam, so that would be a shock trauma kind of thing. And so you don't have to get trained in what to do in that to become a licensed massage therapist or even be a good massage therapist. But gosh, just like your story about the hairdresser, how much better is it to go to a hairdresser who could be okay with whatever came up? So in those kind of situations, I'm not really thinking as much in a NARM context. I'm just thinking about, I'm going to try to bring that person back into the room, get more present with the sounds in the room and the smells in the room or that kind of thing, just to help them come back. But that's less common. The kinds of things that normally come up are more the developmental trauma. So that's where the NARM tools become more helpful.
Yeah. Well, do you have a specific example of something that's happened that you can illustrate some of the concepts?
Well, whether you go to a hairdresser, a massage therapist, or anybody, people's personalities are right there, front and center, and so are yours, and they interact in some way. And sometimes that goes well, and sometimes it doesn't, and for whatever reason. And so I think being educated about developmental trauma creates a lot more compassion because you have more room to understand why this person might be showing up the way they're showing up right now. And not taking it personally. That's something that people always say, right? Just don't take it personally. But that's almost a meaningless thing to say unless you really understand how developmental trauma works.
That's a really good point. Yeah.
There's a lot of those kinds of advice that are great advice, but they don't really stick unless you really understand the underlying components. So there's a way of just being with whatever arises, no matter if that person's trying to make you wrong somehow, or there's a lot of different dynamics that show up in a massage session because people don't feel safe or for whatever reason, or it reminds them of something else, or it's actually getting them in touch with their aliveness and something good, and then there's a bounce back from that. They don't feel like they deserve it. So this is probably the most common thing to address is people's difficulty in saying what they need. So they're in there to get something, just like they would in a psychotherapy session.
Yeah, that's hitting me really hard because I'm thinking about my mother who would never take care of herself. And it was all developmental trauma related. And she would talk about, I can't get a massage. that was just like too much luxury. And now that you're saying this, it's like it was too much potential intimacy, too much care for herself, too much connection to herself. Wow. Wow. Thanks for that insight.
Yeah. I think a lot of people sort of write off those experiences as, oh, that person, can't be intimate. Or like what's underneath that is like, I don't really deserve it. And how can we be with a client with that? The various ways that's not going to show up. They're not going to ask for what they want, or they're going to be very demanding about what they want. The attunement style is going to say like, I want this, I want that, I want this. And if you don't give it to me, you're bad. So if you don't know about that, it's going to be really easy as a massage therapist to have a countertransference response to that of like, well, you can't tell me, don't force me don't tell me what to do. So NARM informed massage therapy is going to get around some of those things. Allow for that person to be wherever they are and be just more curious about whatever they're experiencing.
I can only imagine how safe it must feel if in a session, a massage session, you're really inviting somebody to just be with. Like I've never had that before. I'm like, I need to fly to Hawaii and get a massage with you after COVID.
Yeah.
Oh,
yeah.
Goodness.
So in some ways, the session doesn't look different. I mean, there are some techniques that we do that
it feels different.
but the techniques that we do aren't because of NARM. But nevertheless, the principles of NARM blend perfectly with the kind of techniques that we teach, because it's a deep listening, curiosity with the fingers, not just with the speech. Rather than, okay, here's what I'm going to do, and I'm going to just implement that, and 1, 2, 3, I'm going to be curious along the whole way with how I'm touching. But, NARM or no NARM, that might look the same, but it's going to feel very different because of the relational components.
That's so beautiful.
Yeah.
I'm learning so much today.
It is beautiful.
I'm really curious too, if as you were shifting from neuroscience into massage, if you kind of already recognized you would be working with trauma, or if that was an interest that developed as a result of you're shaking your head. So that was a surprise at some point, I'm guessing.
Oh, yes. The trauma piece was a huge surprise. I mean, when I first dove in, I would say I was rather naive about all the different ways trauma affects people. I mean, I think society is in general naive. I mean, gosh, if I was naive and I was studying neuroscience, and I definitely took clinical classes too, but I really had no idea the extent that the way not only affects personality and behavior, but also the way it affects the soma. Bodies come in and they lay on the table, and you touch them and you feel all these differences. The way the muscles are holding, the way the tissue is, what's up with that? Why does that form that way? And there's a lot of interesting psychological components, and it's not about like figuring it out like an equation or something like that, but just knowing that, oh, this person might be chronically holding this way because of some old personality habits. And the same thing with pain too. Pain is such a problem because we have such a terrible model of who we are as humans. Like we are either, this body-mind split creates a huge problem in treating pain. If we really understand that, gosh, a person can experience more pain because of psychological distress. But, in our culture, people just think, oh, that what you're saying there is just in my head. And that's a completely false, erroneous conclusion, that if a person really understood the neuroscience of pain, that you never come to that conclusion.
Well, I'm also thinking, as you're talking about this, another way to weave in a NARM concept of objectification, because as soon as you started talking about, okay, muscles are holding this way and it's not a formula that we try to figure out, I was feeling that myself. I'm like, yeah, I've got this thing in my back, and if we do this and we do that, we can fix it. But that's objectifying our bodies instead of honoring our bodies, right? And we talk a lot in NARM about objectification and that as a relational trauma, but we're doing that to ourselves often. Yeah. Because of the way society talks about bodies and pain and what they're supposed to do.
Yes, absolutely. I mean, I never really thought about it in those terms, but that's a great way to put it, because there's so much of this concept that if you're symmetrical like a Greek statue, then you're going to be okay. Right. And everyone tries to be that statue. And it's perpetuated in bodywork circles of, here, let me shorten this and lengthen this, which first of all, you can't even do in the first place. And second of all, even if you could, it wouldn't actually solve the problem, because that's not the problem.
Right.
So yeah, just, stop thinking about trying to be a particular way and just like really explore like what is it that you want and need. And
Mm.
that's not actually a cognitive question. It's really a somatic question.
Ooh, say more about that.
Well, the way the body has set up itself, it's doing so, below the level of consciousness. So you can't really speculate about it. You just have to explore it
Hmm.
through touch and through noticing what it feels like
Mm.
internally. So it's very hard to just talk about because it's not
Right.
something we can talk about.
Well, I also feel like that's almost like if one wanted to develop a better relationship with their body, asking that question to yourself and like being with it and allowing it to kind of sink in and letting your body tell you rather than it being a cognitive exercise, right? Like that's an embodied way of moving through that question.
Yeah. Yeah, like one example would be like if a person was having trouble with movement in a particular joint. The usual story is, oh, there must be something wrong with the joint, or oh, there must be a muscle that's too short. But if you put people under anesthesia, they become like Gumbies. Like all our
Hmm.
stories about, oh, I'm flexible or not is all the nervous system.
Mm.
It has nothing to do.
Oh, whoa, you just blew my mind. Hold the phone.
That's one of those deep rabbit hole dives.
My mouth is agape, y'all. Because I'm just like thinking about the implication of what that means. Like, again, this is like agency. Like, we're doing this to
We are doing
ourselves.
this to ourselves. Yep. But, it's not a bad thing. I mean, those are
Right,
protective mechanisms.
right.
Well, so the idea though of like, oh, I'm not flexible, that just needs to go out the door. And realize that, for
Hmm.
whatever reason, you've decided that this is the range that your joint should go to be safe. But you could have experiences that actually limit that further. And it's one of the reasons that flexibility, so to speak, declines over age. We get more and more experiences that convince us that we should have less movement. I'm not saying that there aren't tissue changes over time, because there definitely are. But oftentimes a person has a limitation just because their nervous system has decided that they should. And so what if you just really observe, really pay close attention to moving that arm or leg or whatever it is into that space. And you find that a lot of times people move through that place where they think there will be pain and they realize that they have no problem moving through it. And it's because pain is this predictive mechanism of what might actually cause harm rather than an actual response to something that's damaged. So I'm not trying to go into pain here because I know we're talking about trauma, but it relates. And so there's a lot of interesting things you see in bodies,
The
trauma.
reaction to trauma is protective.
Mm-hmm.
Wow. My mind is blown. I'm kind of speechless right now. Wow.
There's a lot of things like that once you take on a neuroscience frame with bodywork, where everything that you thought was true just disappears. And a lot of people go through a major crisis once they start to realize it. They think, oh my gosh, my life has been a fraud as a bodyworker. But it actually creates a lot more potential for
Mm.
working with people more effectively.
What's liberation?
Mm-hmm.
From the paradigm of what we're supposed to know, which I mean, I felt that crisis learning NARM because
Mm-hmm.
it's a change in frame, and that stepping outside of the frame of what we're told is terrifying at first.
Mm-hmm. Absolutely.
And who am I if I'm not identified with these things?
Mm-hmm. Yeah, that's an interesting thing that's happened is individuals who have been taught, I've seen this over and over again, people who have been taught in the sort of muscle-based way of seeing things, they push back very hard against this neuro
Mm-hmm.
model and actually have a really hard time conceptualizing it. But, when I teach my students this model from the beginning, of course, there's some cultural shift that has to
Mm-hmm.
happen, but it's actually rather simple to adopt it right from the beginning.
Right. Well, I'm curious if there are any specific stories either of inspiration or struggle that you could share with us.
Mm. Well, like I said, I think I was a little naive at the beginning and, not really realizing all that developmental trauma is and what people are holding. And our school, used to integrate a lot of the latest in somatic psychology principles into it. And, what the latest was prior to recently with things like NARM it was the latest, but it wasn't the greatest. I mean, it was,
Hmm.
psychology is a history of trial and error. And so there were a lot of things that we talked about that now through NARM, I realized that those things were actually re-traumatizing.
Like what?
In a lot of alternative, like especially bodywork culture, there's an implicit paradigm of the healing is in the feeling. If you just get in touch with your
Mm-mm.
feelings, you're going to be okay. You're going to be better, or whatever the problem was, you should just go back into it and feel it or something like that. Or maybe scream and yell, kind of like a primal
Mm-hmm.
scream therapy or something.
Mm-hmm.
But, we know now that that's actually a really bad idea. That can cause a lot of re-traumatization, and, it might feel really alive for people. And so it creates this illusion of healing and usefulness. But what it does is destabilizes people, especially if it's in a context where there's not a psychotherapist around. So when I learned NARM, it was like, oh my gosh, we need to do different things about how we relate explicitly and implicitly, and we need to teach different skills. And I need to completely rework how I run a classroom. And I think this applies to any classroom, but especially a classroom where we're touching each other. Like this would relate to almost any retreat kind of setting,
Mm-hmm.
where people come together and then all their developmental trauma relational dynamics are interacting with each other. So in a bodywork school context, what are we usually going for implicitly is some kind of aliveness. And that sounds really great. And let's go for it as quick as we can. But gosh, with the NARM understanding, we realize that's actually not a really good idea.
Because then comes the contraction.
Exactly. And
Mm-hmm.
I didn't realize that at first, until I learned about
Yeah.
NARM. So what occurs then is you have all those contractions forming in various ways, whether it's introjection or projection. And then you have a less effective classroom where there's less safety. People aren't allowed to explore themselves or even learn the content as well, because there's so many interpersonal, intrapersonal dynamics, coming up. So, if we were just studying geology, there'd be enough of that still. But gosh, when we're studying body work, where we're touching people and trying to make each other feel good, aliveness and what gets in the way of it is front and center. And so if you have a bodywork school that doesn't recognize the trouble you're heading straight into and how you need to methodically present materials and work with whatever comes up, it's radically transformed the way that I run a school. It's a completely different setup. For instance, I think in terms of, working with those with connection style, survival styles.
And let's explain that a little bit for folks who haven't been through the training.
Yeah. So those with the earliest childhood trauma tend to develop relational strategies that we call connection style. And that has to do with a deep need to have connection with others. But then that's also the thing that they're most afraid of, they have most challenge with. So call that the core dilemma. So they want connection, but that's the thing that they fear. So they often talk about how they want to have connection or they long for it, but at the same time, they have a number of strategies set up to prevent it. So currently, the way that I think of how I run the school is I want to make sure that those individuals are taken care of first.
I'm blown away by that. And that's foundational.
Yeah.
Wow.
Well, and I want to say too, because they're going to have the most dysregulation, most likely, on average. And because they're also the ones who have spent the most time not wanting to feel their bodies. So they've signed up for a bodywork program because in some ways they want to feel their bodies. But at the same time, they're going straight into their core dilemma.
Right. Oh, wow. I never would have thought of that. Wow.
So if I don't take care of that right away, then a lot of things aren't going to work very well. If I, do exercises that create a whole bunch of embodiment, half the class is going to think this is really fun and cool. And the other half is going to think, I don't know why, but I just feel like quitting. Or I just think that Mark is a jerk or something. And maybe I am a jerk sometimes. I don't know. But
that's an aside.
Yeah. But, all the different kinds of projections and introjections that could occur. So I have to step through the implicit safety as much as possible before doing anything that's towards embodiment. Like a Vipassana style meditation where we're just focusing on sensation seems like it should be nice enough, right? Most people think, oh, that's great. But no, not for, especially those for the connection style. That's a really bad idea.
Right. And Brad and Larry have talked about doing trainings for meditation groups because they've had people freak out on Vipassana type retreats. Yeah. That sounds like a nightmare for me to just be in my head for 10 days, but go on.
Yeah. Well, I have seen that be a nightmare for students. Right. And at first, without a NARM understanding, I didn't really understand that. I can only speak from my experience. It didn't make me freak out. It was great for those people. So why wouldn't it be great for those? Oh, now I understand why it's not okay.
Right.
But, meditation tends to have this spiritual element to it. And there's a lot of narcissistic spiritual things out there where like, hey, this is what you should
Mhm.
do. And you're better if you do it. And you come in there with a NARM perspective and you have to just be okay with where everyone's at and appreciate, respect their experience. So I have found that it's a world of difference applying NARM principles to a classroom, that the outcomes of the dynamics where everybody is applying NARM principles, not just me, as much as one can, is a much more mature, adult, regulated, affirming space. The kind of chaos that could arise without that.
Well, now this is such a great challenge for me to take on too, because I never even thought about, oh, yes, I should also be applying those NARM principles when I teach graduate level social workers. It's the same thing. All the same dilemmas will show up. We're doing different stuff, obviously, but the way that you're talking about this just feels so like open is the word that's coming. It's just there's no static in the air that gets in the way that creates more drama than needs to be. It just feels clean.
Mm-hmm.
That's what it feels like. How
Yeah.
beautiful.
Yeah. Yeah. We want it to be as clean. I mean, just like in psychotherapy too,
Mm-hmm.
the psychotherapist is going to bring their own things to the equation. And so it's never perfectly squeaky clean, but then that's also the fodder for good content. So, but we want to
Exactly.
not add to it more than we need to.
I'm super blown away by this. Is your school the only school that incorporates NARM and massage? Because I feel like this is the way it should be done now, and we should just have everybody do it. Or are you unique? Like, I'm just really curious.
It sounds like a Mandalorian reference. This is the way.
I have not watched it, so
Okay.
I'm sure many listeners can join you in that. But unfortunately, I cannot.
Okay. Is this the only school? Well, I mean, I don't know, but I believe that it is. I'm not aware of any others that are.
That's pretty rad.
I don't think any other schools integrate this sort of content into the program. It would be, in a standard massage program where it's under the communication heading, and relations with clients. So every school in the country has to have some discussion about communication skills and dynamics with clients. But I will say that none of them are going to go as far as we do. And that was before I added NARM. So with the NARM content, I feel like we go to a place that is pretty unique.
Congratulations. I am just really struck by the beauty and the safety that you've created.
I mean, I'm very proud of what has come together, and I certainly didn't know what that was going to be. I thought maybe we would just be changing how I engage, but it turns out that it really does apply to like all of our content and how we teach, how we relate with our clients.
And what is the name of your school for all of the now massage students to flock to you?
It's the Pacific Center for Awareness and Bodywork. We're the westernmost school on the planet, as far as I know.
That's really exciting. Wow. I feel like there's more that we could talk about, but I also feel like this almost feels like a good place to tie a bow on it. But is there anything that we didn't talk about that you really want to dig into? I mean, we've got time to do it if you want to.
Well, I mean, you're right. It's sort of like a chapter kind of place.
Yeah, exactly.
There's like a whole book, right? So I already talked about this expansion contraction piece with classrooms. So
while your goal of helping people understand massage a little bit differently, you definitely convinced this girl. I am really blown away by your work. And now I see why Brad was so eager to have you on, because this is just, it feels revolutionary. I mean, it feels like you're doing something to expand the field, to elevate your field.
Yeah, when I'm in it, I feel the same way, that there's something that's coming together of bringing together the latest in pain science and trauma science and body work. Yeah, all of those I feel like are kind of cutting edge in the way they're being integrated. And I don't say that to be like egoic either. It's just, I mean, it's really fun and really interesting and very valuable to me. So, we just want to do this in a way that is most effective for people. And I think bringing in all of these components is critical if we want to really treat people as whole people and not just muscles and tendons, or, we have to integrate it all.
Yeah. Well, and it's clear, you said this is not egoic. It's very, very clear that you're just aligned and grounded in authenticity with this. So it just feels very right.
Yeah, and we want to do that with the clients, but also with, ourselves. That's part of the work too, is to look at ourselves to at least some degree, to get out of our own way when we're working with clients. And so much of that is often couched in some kind of spiritual narcissism, and we just want to completely get away from that and just ground in what is science telling us about how relations need to work to be effective.
Well, thank you so much for everything you do and for joining us today. I think listeners are really going to dig, because this is quite a different track than we often go on. So I think they're really going to dig this.
I hope so. Thank you so much for having me here, Sarah.
Yeah, be well. Thanks so much for joining us for today's episode. To find more about our guest, check the show notes or visit us at www.narmtraining.com/transformingtrauma. You can connect with us in many ways. On Instagram, find us under @the NARM Training Institute, on Twitter @NARM Training, and Facebook @NARM Training as well. The NARM Training Institute also offers The Inner Circle, an online self-paced learning program intended for anyone who is interested in joining an international online community focused on healing complex trauma. You can find more information about these trauma-informed learning programs, in addition to other resources, on the website www.narmtraining.com. Thanks to Andrea Klunder and the Creative Imposter Studios for producing and editing, to Tori Essex for our album art, and to Brad Kammer for the creation of this podcast. We look forward to building community and connection with you and changing the world by transforming trauma.